So we have started a series of video on scores in stroke. Today we are going to talk about in ischemic stroke we find the two score. The one is called aspect score and another is called NIHS score. So today we are going to talk about aspect score. On this city brain I will show you the aspect score. So let us talk about it. So we had already uploaded videos on transient ischemic attack in which we find ABCD score, in subarachnoid hemorrhage in which we find HNH and MFS classification, in ICBs we find ICH score. Today we are going to talk about in ischemic stroke we find the two score. The one is called aspect score, the another is called NIHS score. Aspect score is here, we will talk about it. Now ischemic stroke, the damage of ischemic stroke we calculated it on aspect score and NIHS score. Aspect score is radiologically and NIHS score is physiologically, I mean on examination. So today we are going to talk about aspect score. What does it mean by aspect? Aspect is mean A Albert, S mean stroke, P mean progressive program, and E mean early, CT का मतलब है CT and score. So Albert stroke program early CT score. Now there are different area which we are going to find on CT brain. So let us explain it here. For this patient they give us the CT aspect score 4/10, but we will find it. Now if you look to this CT brain, first of all we have to find what is the abnormality on this CT brain. This is the right side of the CT brain, this is the left side of the CT brain. If you look on the left side of the CT brain, there is hypodensities, and this hypodensities is actually ischemic stroke. So this patient is having ischemic stroke. Now we have to find the aspect score on this CT brain. So we will zoom it and we will go to near to see how do we have to find the aspect score. CT brain, these black you see, these are the lateral ventricle, and this black is the CSF. When you see these two horn, like here you guys can see these two horn, this is not completed and not meet this area. So it's mean if you see this is a half horn of the lateral ventricle, so there you can see M1, M2 and M3. This is blue is for caudate nucleus, this is internal capsule, this is the lentiform nucleus, and this one is the insular ribbon. So you guys can see here the one area is caudate, insular ribbon, internal capsule, lentiform nucleus, okay, and the one is M1, M2 and M3. These areas you see here. Now for another picture we are going to see M4, M5 and M6. It will be at the front of the full lateral ventricle. You guys can see here this CSF, you can see this black is CSF, and you can see the full lateral ventricle. Here you guys can see here there was discontinuation, but here it is continued. But when you see the lateral ventricle fully, at that area you have to look for M4, M5 and M6. Okay, now let's find it on CT brain. Okay, now you guys can see this CT brain, and you see this is the lateral ventricle, the CSF look on CT brain black, but there is discontinuation, and if there is discontinuation at front of that, you have to look for M1, M2 and M3. Now see the hypodensity. This area is for caudate nucleus, this is for the internal capsule, this is the lentiform nucleus, this I is for insular ribbon, this is for M1, this area is for M2 and this is for M3. Now look where do you see hypodensities are black. So I see at the M2 area, this is the M2 area. I also see it on the insular ribbon, lentiform nucleus, internal capsule and caudate nucleus. Now we have to tick mark this area 1, 2, 3, 4, 5. So 5 is on this area. Now we have to click it here. I can see the caudate nucleus, okay, click it. Insular ribbon, click it. Internal capsule, click it. Lentiform nucleus, click it, and I also see it on the hypodensity R and M2. Now I have to look for M4, M5 and M6, and there on CT brain, if you guys can see here this CT brain, I say that when you see the ventricle fully, this is the full ventricle with the CSF, there is no discontinuation in the full CSF or full lateral ventricle, you guys can see. So in front of that you have to find M4, M5 and M6. I can see the hypodensities on M4 and M5. So let us click it here now. I see the hypodensities on M4 and M5. So now what are the total count of this now? I have to count it. 1, 2, 3, 4, 5, 6 and 7. Now the total score for aspect is 10, and the area on which you see the hypodensity, you have to subtract it from the 10. I see the 7, so 7 minus 10, it will equal to 3. It's mean that the aspect score for this patient is 3, which mean that this patient have there is more damage which is caused by the stroke, because I can see the hypodensities on in many areas. So this is how you have to find the aspect score. Okay, the damage which is caused by the ischemic CVA, radiologically we go for CT aspect score. CT means CT brain पे हम देखते हैं CT aspect score, and examination or physiologically we can go for NIHS score. Radiologically we will look at CT brain, and if the score is less, then there is more damage, and if the score is high, there is less damage. NIHS score. So my next video will be NIHS. This is very important, and by last video, which will be on NIHS, we will be finishing the scores in stroke, like ischemic aspect, NIHS, TIA, ABCD2 score, SAHNH, HNH and MFS score, ICB, ICS score. I already uploaded video on ICB, SAH and TIA.